everyone, my name is Siddiqua Fathima. I am currently pursuing fellowship in clinical optometry under the Indian Academy of Optometry. In this video, I will be explaining you about the pre-operative LASIK evaluation. LASIK stands for Laser Assisted In Situ Keratomyelitis. The first and most important step is history taking. Record the patient's demographic data, occupation, systemic health condition followed by a detailed ocular history including previous eye examination, ocular trauma or contact lens usage. It is important to consider refractive stability for at least 6 months before considering LASIK. Next, we assess the unaided visual acuity and best corrected visual acuity using standard charts like Snellen or logmark, followed by an objective and subjective refraction to determine the exact refractive error. It is important to know the type of refractive error, whether it is myopia, hyperopia or astigmatism. It is also important to consider if the patient's refractive error is suitable for LASIK or not. For LASIK, the ideal candidate should be above 18 years with stable power. We can correct myopia up to -8 diopter, hyperopia up to +4 diopter and astigmatism up to 4 diopter depending on corneal thickness. Patient wearing contact lenses must stop soft lenses for at least 1 week and RGP lenses for 3 to 4 weeks because lenses can alter the corneal shape. Next, we move on to slit lamp examination for anterior segment assessment. Here we mainly assess eyelids, tear film, conjunctiva, cornea to detect any abnormalities before considering LASIK such as corneal scars, early signs of keratoconus or any active ocular infection, inflammation or ocular diseases. Tear film can worsen dry eye. It is crucial to measure the tear film stability, which can be done using tear film breakup time (TBUT), where we instill the fluorescent dye and ask the patient to blink. Time is measured till the first dry spot appears. Greater than 10 seconds is considered to be normal. An alternative way to assess tear film is Schimmer's test. It measures the tear production using a sterile strip which is placed in the lower eyelid for 5 minutes. We look for tear wetting. If it is greater than 10 to 15 mm, it is considered to be normal. If it is less than 5 mm, it is considered to be severe dry eye. If a patient has severe dry eye, LASIK can cause more dryness and more discomfort. It is best to treat the dry eye first and then move to LASIK. Followed by keratometry. Keratometry measures the corneal curvature. In LASIK, it is important to measure the corneal curvature values. Normal values lies between 40 to 45 diopter. Either too steep or too flat can make LASIK unsuitable. Corneal topography maps the surface of the cornea in 3D. It is important screening test to be done before considering LASIK as it tells us about the shape, curvature and irregularities of the cornea. Warm colors such as red indicates steep areas and cold colors such as blue indicates flat area. Next, we move to non-contact optical pachymetry. Pachymetry measures the corneal thickness. In LASIK, it is extremely important to know the corneal thickness. Normal values lies between 520 to 540 microns. If it is less than 480, high risk of ectasia. If the cornea is too thin, the patient is unsafe and alternate considerations can be taken like PRK. So after the anterior segment test, we also do the posterior segment evaluation, dilated fundus exam, intraocular pressure and wavefront analysis to rule out retinal issues and check visual quality before LASIK. Our goal is to make sure the patient eye is healthy and ready for LASIK. All the test parameters should be normal for a safe and successful LASIK candidate. Thank you for watching.